Good afternoon. I'm Senator David Carlucci. Want to thank everyone for joining us here tonight on the Facebook Live, trying to keep in touch and keep you up to date with what's happening in New York State and in Rockland and Westchester counties. Tonight, I have with us some special guests that will come on in a few moments, talking about the angle from the first responders. And so I'm really happy that they'll be with us tonight. But as we're speaking now, we have over 202,000 confirmed cases of COVID-19 in New York State. We have over 20,000 cases in Westchester County, and we have over about 8,300 positive cases in Rockland County. And with that, we know throughout New York State, we now have, unfortunately, 10,834 deaths. That's today, April 15th, 2020. And we also have 18,825 hospitalizations. And that number, compared to the amount that's being discharged, is now almost about equal. And we see that it's looking like we're at the apex, where we think that this is as bad as it's going to get if we continue to practice social distancing. And unfortunately, it's still a heavy price to pay. We lost over 700 New Yorkers yesterday, and that's a pace that's going to continue. So we have to do what we can. We have to help our first responders. We have to help those on the front lines in the medical community, and we do that by social distancing. Today, the governor said he's going to sign an executive order requiring people that are in public and unable to be at least 6 feet apart from one another to wear a covering over their face. This is not necessarily a mask, because we want to save those for our first responders and those on the front lines in our healthcare facilities. But this could be a scarf, a bandana, something that you make at home. And this is common sense. We need to institute that common sense. So even if a law doesn't tell us to do it, if the governor or the legislature hasn't enacted a requirement, we need to follow that. That means, wear gloves, make sure that you're keeping a safe distance as well as you can, limit the amount of time that you're going out, even to the supermarket. We need to be careful, and that's how we're going to protect ourselves. I know we've all now been touched personally, particularly in the Hudson Valley and Rockland and Westchester counties, with the amount of fatalities we've had. We all know someone that has passed, and unfortunately, that number is going to continue. Right now, we're having an unprecedented amount of calls that are coming into my office, but I want to make sure that you know that we're here for you. Even though the office is physically closed, that our phone lines remain open. The email is open, so please do not hesitate to contact us anytime with the problems that you're having. My phone number, 845-623-3627, and the email is carlucci@nysenate.gov. And also, we're doing a text program where you can get text messages up to date on your phone. Just text the keyword Carlucci to the number 797979. That's text the word Carlucci to the number 797979, and you'll get text alerts on your phone. Also, please visit our website, senatorcarlucci.com. That's senatorcarlucci.com, and there you can sign up for our email updates. And that really gives you a lot of information about what's happening here in Rockland and Westchester counties, as well as what's happening throughout the state. So please do sign up for that email newsletter and pass that information along to your friends. One of the issues that we're dealing with right now is that we are expecting stimulus checks to be hitting mailboxes and direct deposit accounts in the next few days. And the troubling thing about that is that, unfortunately, if you have not filed your income taxes recently in the past year, then you might not be receiving that stimulus check. And that's a real problem. So please do give my office a call if you fall into that category. There is a link on the IRS website where you can sign up. That's if you have not filed your income taxes in the past couple of years. You can go to the IRS's website and sign up for that right there. So that will allow you to get that check. The other issue that we're working on right now is the issue that these stimulus checks that are being sent out under the Consumer Protection Act, there is Consumer Credit Protection Act. There is room to make sure that certain payments are not garnished. And that means that once you get this stimulus check or other payments, that who gets paid first? The creditors. And that makes sense in normal times. But the idea behind the stimulus checks that are being sent out to people across the country is that it's to really make sure that their lives are disrupted as little as possible. By allowing what Congress and the president have done is they did not put a special code on this payment to make it a government benefit that would not be subject to wage garnishment. The governor has sent a letter to the treasurer, to the Treasury, Steve Mnuchin, and has asked that they code it as a government benefit. And this way, residents in New York State would not have this stimulus charge. I have put a petition on our website, and that's at senatorcarlucci.com, where you can go and sign that to urge Congress, to urge the Treasury, actually, to code these COVID-19 stimulus check payments so that they will not be garnished. That is extremely important because these checks that will be garnished are going to the people that need them the most. So we cannot allow that to happen. I'm also introducing legislation that would allow for the stimulus checks that come to New York State residents to not be garnished. We were hopeful that this would be done through the Secretary of the Treasury, but it doesn't look like that's happening anytime soon. So the last resort is to pass special legislation. I also have another petition on our website that I wanted to make residents aware of. Facebook has been generous. They've been offering $100 million in grants to small businesses, and that's great. They say that they wanted to go to communities that have been impacted by COVID-19. Well, we know in New York City, Westchester, Rockland counties, we've been hit the worst. In fact, in Rockland, we have the highest per capita population of any municipality in the nation that's been hit with positive cases. Unfortunately, when you go to Facebook's website and you try to sign up for this grant, it does not include Rockland County as an area that's been impacted. That's unfortunate. Fortunately, Westchester County and Long Island are included, but Rockland is left out. We need to have that same benefit, and we need to make sure that Facebook recognizes that Rockland exists and it's been under the same type of scrutiny in terms of this disease, and that it's impacted us just as well, and we should be available for that grant. So with that, we're so fortunate tonight that we have special guests tonight, our first responders that have always go above and beyond to protect us. I have two gentlemen with us tonight that I've gotten to know over the years that are just the epitome of dedicated public servants. First, we have the Chief of Police of the Ossining Police Department, Kevin Sylvester. And Kevin, Chief Sylvester, has been with the Ossining Police since 2003. And when he was elevated and promoted as the Chief of Police in Ossining, at the time he was the youngest police chief in the state of New York, and he still, looks like a baby. But no, but he was it was a few years ago, so he's getting older. But we share that in common. When I was elected to the Senate, I was the youngest member of the Senate, and it was a real honor to do that, to be at a young age, and everyone much older. So you brought a different perspective. But I'm sure the chief gets this question, and I would get this as well. They'd say, well, were you the youngest ever? And I know that that's not true for me, because the Senate, like the police departments in New York State, have been around hundreds of years. And back 200 years ago, when you were 35, you were an old man, and it was towards the end. So we know there were some younger ones before that. And so we're honored to have him tonight to tell us what they're doing, what they're seeing on the front lines to keep us safe, and what other type of protocol they've had to institute to make sure that they're still able to do their job and keep our communities safe. We also have the Chief of the Ossining Ambulance Corps with us tonight, and someone that I know who wears many hats but is always at every event and is always there to respond and keep people safe. And that's Chief Nick Franzoso, who has been serving as the chief of the Ossining Ambulance Corps and their director as well. Before that, he spent a decade traveling around the world building scenery for TV, which must have been very interesting, but giving you those different climates and places to work in to be able to adapt every day to the changing environment that's going on now. So with that, I just wanted to welcome you both. Thanks for joining us, and thanks for spending some time. I know you guys are extremely busy right now, working around the clock. So maybe we could start with that. What have you guys seen? And maybe we'll start with the chief of police, Chief Sylvester. What have you seen in terms of calls coming into the police department and dispatches going out to the community? Have you seen an increase? Have you seen a decrease because people are scared? They don't want anybody visiting them. What's going on the ground?
Well, first, Senator, thanks for having us on today. We're really glad to have this opportunity to share a little bit about what's going on and connect with people. But, it's been a really interesting time. Crime stats are likely down pretty far right now. People are typically staying indoors and, for the most part, cooperating with not only the orders, but, the things that have been asked of them up until now. A lot of our calls for services are medical, and Nick can talk a little bit more about that. But, we're doing a lot of medical aids. There's a lot of anxiety right now. And now more and more as the general orders, or rather the executive orders, are coming down with new things like wearing face masks for essential workers, or now for everyone. We're getting more and more calls about people that are just concerned about how neighbors are behaving. So a lot of what we're spending time on right now is just trying to keep the social balance of things when we're not trying to get have the power put back on. Yesterday was a little bit hectic with the storms, but right now it's really trying to provide people with a little bit of normalcy.
Yeah, and Chief Franzoso, what have you seen at the ambulance corps?
So again, thanks for having us on today. It's great to be able to express what's going on. So for us, we've seen an increase of call volume, not tremendous, but we've seen that a lot of the calls that we're responding to are all COVID calls, people with symptoms or people who have been tested positive who are potentially getting worse and need to be transported to the hospital. We're seeing a decrease in calls for something like a fall, with having families home, somebody's around to help pick somebody up in those cases. So, we have seen an increase of just severe medical calls or just medical calls in general, and less injuries based on falls or motor vehicle accidents have pretty much gone away at this time. So that's the basis of where we're at. We have increased our staffing just to kind of combat the extra call volume, kind of running 3 or 4 ambulances a day during the peak times just to combat multiple calls all at once. And then having the extra staff around that could help do 2 things. One thing is the decontamination, make sure people's PPE is properly put on, properly taken off, make sure that the trucks are cleaned after every single call, sanitized and disinfected as necessary. So, we're seeing that is our day-to-day at this point.
So, Nick, what would you say? I'm sure there's a lot of people. I've been making a lot of phone calls, particularly to older residents, just making sure they're okay. And a lot of times the question will come up about the symptoms and when is it time to call for emergency assistance, to call the ambulance. What do you suggest? Because I know there's a lot of people, including myself, you get one cough and you're very paranoid, and rightfully so. So what type of guidance do you give to the general public about when is it a good time to call and make sure that you're getting over to the emergency room?
So New York State Department of Health has done a great job about educating and sending some guidance for us in this area. They put together some protocols for us to go to somebody's home, assess them, and based on certain criteria, try to leave them at home because their symptoms are not severe enough to be in the hospital, or to transport them depending on what the conditions are. But, from what we're seeing, most of the cases for COVID-19 can be treated at home using over-the-counter medications like Tylenol for a fever reducer. The times where we're transporting people is when they have severe difficulty breathing and their oxygen stats are lower than typical. And that's what we're really waiting for to happen. People stay home, most of their symptoms will subside, but for those that don't, once they're having more difficulty breathing, anything to that effect, is when we're going to initiate transporting them to an ER.
Okay. Well, thank you. Have you gotten calls where it's is it always calls that is an emergency situation where you're sending a rig out, or are sometimes people calling and asking questions? Does
We've
that ever
had a
happen?
couple. We've had a couple people just call the building in general, asking some questions. We're more than happy to provide some guidance over the phone, but it's hard, depending on what kind of equipment people have at home, to test their blood pressure, to test their temperatures. I know thermometers seem to be something that you can't find anywhere anymore. So the fact that we have them and we're able to help assess and just show up and help kind of walk people through that. And luckily, the state has provided some guidance that we can leave with people. So they've provided a couple forms that if people have questions, they could call the toll-free numbers or the hotlines to schedule testing or to schedule follow-ups with doctors. So, that does help.
Okay. So obviously the police department, the ambulance corps, you're in a position where physical contact many times just cannot be avoided. What type of new protocols have you put in place to mitigate the dangers to your officers, to your EMTs? Chief Sylvester, what have you guys done? What's the best practice that's been implemented? Everyone, no matter what industry you're in, has had to do a whole new set of best practices, including the state Senate. We now passed a resolution where we're able to vote remotely. So we're hopeful we have a robust legislative session to continue. But Chief Sylvester, how is it impacting the police department in where many times physical contact just cannot be avoided?
That was a real eye opener for us because everybody knows this is a job we signed up for, but at the same time we're still human. So first and foremost, we've been managing the concerns of staff because they've got to have confidence that the equipment we're giving them is enough to keep them safe. Everybody has masks, both those issued, but we're really glad to see that a lot of the staff are coming in with things they bought on their own so that they can have, that additional layer, just extra equipment around. We've got gowns and gloves and all of that stuff supplied. The complex issue with law enforcement is that oftentimes, we may get sent on a call where the officers don't have time to get out and put gowns on in order to deal with something. Thankfully, with criminal acts, at least calls for crime service seem to be down right now. That's not been the major priority. But, look, our staff are coming in, and just like everybody in any industry having contact with the public, these folks are worried with every call that they go on that they're going to leave here and they're going to bring it home. And they've, many people here have children and families at home that they're worried about spreading onto them. So we've changed our staffing a little bit to try and spread people out. So anytime we have extra we're trying to stay at our minimal staffing levels as much as possible and spread them out so that people have less contact, not only with the public, but with one another. We've started taking everybody's temperature a couple of weeks ago as they come in the building every day so that if anybody's feverish, they'll be precluded from working that day. We're following this ever-changing guidance, and with every day there's a new order, certainly making the staff crazy. There's every day there's another layer of another thing we're going to try to do, and none of it's going to be perfect. We're sort of taking a chance with everything we do, but the theme here is to do as much as possible, and again, to give reassurance both to the staff and to the community.
Yeah, no, that's extremely important. And just to follow up on that, Chief, what has been the most common call that you're getting now over the past few weeks? What is keeping the officers busy now?
In the beginning it was medical calls. Now with all the executive orders coming out that are, ever increasing in the amount of PPE that we're requiring of regular folks in addition to essential workers, we're starting to get a lot of calls where people are notifying us of their friends, neighbors that aren't perhaps complying. We're doing the best we can to work with those, and we're grateful for people to be our eyes and ears because we certainly can't be everywhere at the same time. But, the larger concern for that is just that folks are so anxious about the behavior of their neighbors that we're starting to take calls on things like that. So, we've assigned some extra patrols to take a look at parks and other places that people congregate to try and, this is it's not an exercise in enforcement. It's discretion is going to be the key to this, and it's educational, it's encouragement. It's giving people information and asking them to comply for their own protection. So a lot of what we're doing now is social distancing policing, which is a whole new concept for most of the staff. But, it's what we have to do to make it happen.
So what does that look like? Is that like, I always remember when I was town clerk, and I tell people the story about how we think about sometimes in the Senate, things can be very controversial, that there's controversial votes and all that. Well, the biggest controversy, the biggest problems that I've seen in the past have been these local neighbor to neighbor disputes. And those can be some of the most dangerous and ugly situations. Is it situations like that where you have just the neighbor saying, hey, I saw an extra car come into the garage? What things are you seeing? And is it escalating? Because what I saw initially was some people just not getting the message, not realizing how severe and how serious this is. And that makes sense because in our lifetimes, we've never had to deal with something like this. But now it seems like you can't not get the point, and you see the amount of the death toll that's happened. Have you seen it? Has it gotten better in terms of people complying? Is it more that people are just more anxious and calling the police? What type of situations are you seeing?
So we're definitely seeing people more apt to comply. I think that the more that this touches people personally, the more that people are understanding the gravity of the situation. And I think for a little while we had a lot of folks that didn't see this firsthand, and as they have a friend or a neighbor or a family member that becomes infected, people are really starting to understand. And that's what we're hearing from a lot of our local vendors that are still open, so from our grocery stores and hardware stores. We're glad to see the participation in social distancing and the cooperation with it to be increasing. In terms of the calls and how they're sort of evolving, look, we're getting more calls about people calling. When I say neighbors, I consider all of us to be neighbors, so they're simply calling on other people in town, either passing by a park and feeling like people are too close together. Thankfully, everybody's really being as reasonable as possible. For the officers, like I said, in terms of this being an exercise in discretion, we're doing everything we can to talk to people, and the cops themselves are trying to socially distance as they do this. So I've seen some of them pull up to a field with the PA system and just announce to people. But kindness is key in this case, because the reality is that the folks that are outside and that may be congregating aren't congregating because they're trying to cause a hazardous condition. They're people that are feeling cooped up in the house that want to get outside, and I think we can all sort of understand that. So, our goal is to be as kind as possible and help people to understand as much as they want to get outside and get fresh air. There's a safe way to do that, and that's what we want to direct people towards. So we haven't really seen an escalation in neighbor disputes per se. We're just getting a lot more people that are so concerned about the behavior of others that they're calling the police now, and that's sort of unprecedented to call the police for people standing next to each other. But, it's to be expected in this time. It's something we got to work on.
Yeah. And Chief Franzoso, what are some of the protocols that you guys have put in place? I know in talking to you in the past, I mean, you've been with the Ambulance Corps for a long time. You started as a volunteer with the Youth Corps. Years ago, I participated in the Youth Corps over here at the Valley College Congers Ambulance. I realized I wasn't cut out for it when things got real and on the scene, and so my gratitude goes out to both of you, because it's not easy and it's not for everyone. But so you've been doing this for years, and you've always had to take precautions, and I know you guys are very serious about that. What are some of the added precautions that you've taken for everyone that rides on the rig?
So the first thing we implemented were wearing more personal protective equipment. So the masks, surgical masks, definitely on every call. And then depending on symptoms, we would increase our level of protection to N95s or full face respirators, which will give us the added eye protection. In doing so, you want to make sure that anyone who's coming in contact with somebody at this point, we don't know. Some people might have mild symptoms, some might have severe. So we're taking the extra step to ensure that people are fully protected when dealing with a patient. Trying to do an assessment from the door is a guideline that the State Department of Health put out. So trying to ask some of the questions just as a double check to ensure that people you're getting the best information. But really, to limit our exposures the most is to wear a mask. There's a lot of guidance from the state about that. And then even so, to anyone that we transport, the hospitals are all requiring somebody to wear a mask upon entering. So, we're putting a mask on somebody as soon as we come in contact with them. which will reduce our exposures, reduce their exposures, and transmission rates. So that's the biggest thing we've seen. I mean, we've always planned for, for a call that has, hazardous kind of situation, whether it's with blood, whether it's from a virus or disease. So, we've always taken those precautions. Right now, it just seems that it's on every call as opposed to once or twice a day. And then for us, for decontamination, every time we transport somebody, we're making sure that we go on a deep clean cycle of wiping down the surfaces, spraying disinfectant. It's something that we've definitely taken pride in over the years to ensure that, we are safe and that we're not bringing stuff home with us at the end of the day. We've provided some extra measures for people to wash clothes here in the building, some other devices which will help sanitize and keep people safe, just to prevent the cross-contamination and potentially bring it home. Just like Chief Sylvester said, our staff is just as concerned about bringing something home. It is real. We've seen people from other agencies and other areas that have gotten sick from this, just based on not knowing somebody's symptoms or becoming, symptomatic days later. And who knows, it's an evolving process for us. It's an evolving process for the community, for, practically the world at this point, us learning new ways of doing things, increased precautions, making sure that, we don't fall sick ourselves, because that will be the worst end of it too, for us not being able to provide help. So those are some of the things we've done.
And with that, do you have adequate personal protective equipment? Do you feel like you have adequate supply? It's coming in. Where are you with that?
So for us, I mean, I've been very proactive for the last kind of 2 months, that when we started to see cases building in the United States, that we would take steps to ensure that orders are placed and that personal protective equipment is coming in. We do have a decent supply, which should last us a little while, for masks and gloves and gowns. Switching to full face respirators has definitely helped us kind of extend our life expectancy of masks and protection. But there are agencies that are struggling. I mean, it's very hard to plan for something that, is now lasted, a month and a half, and what's going to happen in the future and how long this is going to go for. Just like Chief Sylvester said, the governor putting out new orders of everyone wearing masks when contact with the public is definitely going to take some of the supplies away from us, I believe, just because people could get it. So, for us, we're in okay shape. We have requested some stuff from Westchester County. The county and the state have been good about providing some additional resources when needed. But PPE is still something that's a concern for everyone in the county. Hospitals need it, healthcare system need it, nursing homes, childcare, and then goes out to the first responders. Everyone in this area needs it. Fire departments as well, going to some of these facilities, they need to wear personal protective equipment too. That's not just their normal operations. So.
Yeah, Chief Sylvester, how is it going for you guys at the police department for personal protective equipment?
So we're doing okay. We started out ordering just like OVAC did. We were starting ordering early, and it's a fantastic community here in Ossining where OVAC has an oversupply and they're offering to share supplies with other people, and we're all grateful for that as our safety net. We've got a good amount of PPE. It's changing in terms of what levels we're giving to people now and how to use, like Nick said, some of the longer term stuff. It's a real challenge to get some of these items in. It's easy to get surgical masks and some of that lighter stuff. You can buy those in bulk. But, for instance, we have staff that asked for respirators, reusable respirators with filters. And, they've been on order for 4 weeks now with a delivery date of May 22nd. And we're going to leave them, because if this is still going on, we didn't think a month ago we'd be in the position we're in now, and, nobody knows where this is going, but we're going to do that. So what we're doing at this point is we're just sort of ordering extra of things and trying to stay within our budget, but, buying things that we're not sure if we're going to need so that when they come here, we'll have them. Oftentimes in municipal government, you're trying to buy only exactly what you need to stay within your budgets and keeps taxes down. Our priorities are really shifting here from things that we would have otherwise been doing in terms of enforcement. We're really looking at options for PPE because, look, when you're trying to put out a best product, one of the things that you've got to acknowledge is that the more comfortable you make these employees, and if they can come to work confident that we're going to keep them safe and healthy and not put their family at risk when they go home, those folks are going to do the best that they can. So I'm not going to pretend to say that we've got everything we need. We certainly have a lot, and we're continuing to shop for things. But it's a struggle. A couple of the things, thermometers, like Nick was saying, we a month ago we started ordering digital thermometers, infrared thermometers to check people coming in the door, and two of them are still. I think we ordered 5, and we got 1, and the rest of them are still on order. So. They're just items that, and that's for us, and imagine what the general public's looking at. So,
right. Yeah, we had a question come in. Besides the PPE, how about decontamination equipment like wipes, sanitizer? How are you guys doing with that?
So OVAC is the best in the business, and I think they're sanitizing the entire North America at this point. I don't know.
Okay.
They've got some fantastic gear, and we'd really be lost without them. I mean, they were ahead of the game like nobody else with sprayers and mixing their own cleaning supplies and all sorts of stuff that nobody really expected to do. And they're really making the difference in this department right now. I mean, there's no doubt about it that places that, we didn't see it coming, OVAC really was ahead of the game on that. So, we're forever trying to buy another box of wipes and some more spray and paper towels and the never-ending search for toilet paper, I suppose. But OVAC's really saved the day with their sprayers and the decon equipment.
So Chief Franzoso, could you tell us about that? So you guys come over and you help out and facilitate with the police?
Yeah, so we've kind of worked with a lot of the emergency departments in our area over the last probably month. We're having people come to our building, sanitize vehicles and sanitize, their equipment. So we do have an on-site generation of solutions for hypochlorous acid and sodium hydroxide so that we can help facilitate other places that need some assistance with getting by in this time. Luckily for wipes and stuff, there's a couple manufacturers that are still out there stocking, a couple vendors that are out there. So, we're working our way through it just like everyone else. Supply lines are down, supply and demand. You see some increase in pricing for some stuff, but we're happy that for the last couple of years, we kind of looked at what we could do to prevent sickness and illness and have some disinfecting solutions that we can have control over. So, we took some steps to implement that and have that. So, I'm definitely grateful for the fact that a few years ago we did this because who knows where we would be without it. So, we're happy to assist and happy to help because, we know in this time, like many, you can't find anything. So.
Well, we're all thankful to you for going above and beyond and thinking about that in terms of how you can be best prepared to react to the problems that we're facing. So thank you so much. Chief Sylvester, I wanted to ask you about domestic violence. We know this has been a crisis in our community throughout the nation for years. And unfortunately, we're all very concerned about the situations going on right now where people don't have a place to go and they might be quarantined with an abuser. Have you gotten calls? What type of advice do you have that someone that is struggling might be in an abusive situation?
So, look, it's certainly a situation that, or it's a condition that we saw as being an important issue for us as soon as this kicked off. So every day we've got a countywide call with all the police chiefs, and there's a daily review of domestic violence procedures and policies and resources that are available and looking for trends and things like that countywide because it's a lot easier to look at it from the large scale. We haven't seen a marked increase in domestic violence, but certainly it's one of those things that we're sort of expecting that at some point there may be an increase. The advocacy groups are still working. My Sister's Place and the Women's Justice Center, a lot of them are still working. They're working remotely, so their capacity is a little bit diminished. But certainly, if anybody's in a situation, I mean, there isn't a worse scenario than to be in an abusive relationship and then have to be quarantined with somebody where there's nowhere to hide. So, every opportunity we have to go on these calls, we're looking to deliver as many connections to resources as we can to try and help people find a safe way out if, in fact, that's what they're ready for. But yeah, domestic violence right now, it's concerning. The longer that you have people in a home together and they can't leave, even the best of relationships sometimes deteriorate. So it's something that we're looking at all the time.
Yeah, it's so important. I think the message we need to get out there is that if there is someone that is trapped, to please reach out to us. To obviously call the Chief Sylvester, call the Ossining Police Department, call your local police department, or call me. Call our office, and we will make sure we get you the help that you need. You do not need to stay with an abuser, even in this crazy time. There are resources available, and we can get you out of that situation. We know that the state has been proactive in regards to orders of protection, that those have been extended, that they won't expire during the length of this crisis. That's something important to remember. We now, thanks to the help of many people, we passed legislation that took effect this year that allows for anyone or any survivor of domestic violence to be able to report to any police department in New York State. Prior to this year, we had an old law on the books that just didn't make sense, that said that you had to report it in the jurisdiction where it took place. Mm-hmm. And we found that was just it was just working against us, because there was many people that have to flee their situation and they can't go back to the locality where they were victimized. So simple steps like that, we're moving forward. But I'm fearful that this crisis has just taken a step back on so many different issues, but particularly domestic violence. I know that Chief Sylvester, your office has applied and has been granted a crisis intervention team training. That was funding that was provided through the state of New York, something that I've been pushing a long time. And basically what that is to train our first responders, our law enforcement, to be able to de-escalate mental health crisis situations. And I was wondering if you have yet been able to access that, if any of your officers have been able to get trained on that yet, if that is happening, or if not, we'll make sure that it does soon.
So we spend a lot of time on de-escalation, and crisis intervention is pretty much everything at this point. I mean, that is policing, really, is what we're finding. People talk about crisis intervention. I mean, if you're calling the police for something, it's a crisis. I'm thankful to work with some really amazing people. I know everybody that gets to a supervisory position loves to say that their people are the best. I don't know if mine are the best, but I can tell you that I am incredibly fortunate to work with some really talented individuals, some really compassionate and caring people. And they understand the position that we're in, and that this isn't simply an illness that's going around affecting people physically, but that it's affecting them emotionally. Again, the county chiefs is looking every day at ways to deal with crisis intervention, and one of the things we dealt with today is where to take people with emotional issues, because you can't simply transport people to the hospital at this point when they're in crisis. You've got to find ways to, hospitals overwhelmed. So, we're really doing some creative things right now. And I'd like to think that even before this happened, our officers were doing a really great job of talking people down and sometimes solving a crisis on scene, or at least diffusing a situation in the immediate. Right now, they're really honing their skills. This is the peak of, we're getting peak use out of people's interpersonal communication skills at this point, because, this isn't all about muscles. This is about how we deal with people and helping them understand. Because look, you have to understand whether it's someone who's in crisis because they deal with mental illness on a regular basis, or somebody who's just completely overwhelmed by the way the world is right now. That's what we're dealing with. And it's everything from small meltdowns to large crisis, but that's where we're at. So thankfully, I have to say that our people are incredible in these situations, and I'm really grateful for that. But yeah, we spend a lot of time training on that. And I think the really important thing in law enforcement today is you don't just look at crisis intervention in terms of the emotional crisis, but this is everything from the small job up to an active shooter situation. All of them require that same skill set of diffusing things, de-escalating a situation. So we try to make that part of the fabric of how we police.
Yeah. Well, that's great. It's such a smart approach. It sounds like that you can de-escalate these situations before they really boil out of control and physically harm the officer and also the person that they're dealing with. So that's extremely important. Chief Francisco, did you have anything to add to that in terms of how are you dealing with the calls that you're going on to make people feel at ease or allow them to rest assured? And are you coming across mental health crisis as well?
We do come across some of those calls. For us to ensure.
Oh, I don't know.
Sorry. No.
There we go. Okay, we got you.
Sorry about that. Somebody tried calling me there. Kind of to add to that, we try to make sure people are comfortable with what's going on and understand the precautions that we're taking and try to ensure that people understand why we're wearing levels of protection or why we're providing a mask for them to wear, and trying to reassure them about their symptoms and educate them as best we can. Everyone's a little bit stressed out by this, and you could see that people are affected across the board, and trying to just be there to be reassuring and to provide as much data as we can, some handouts and stuff like that help ensure people that staying home might be the right idea, or going to the hospital might be the right thing to do at that given time. We do come in contact with some people who are having just a regular medical emergency that have no COVID-19 symptoms at all, but are fearful of going to the hospital and potentially contracting the virus. So, we're trying to ensure people and make sure that, the hospital staff is prepared for those people to, not just isolate those who have COVID-19, but also keep the people who don't have it from getting it in that environment. So just being reassuring is really important.
Yeah, that goes such a long way. I wanted to ask both of you, since we talked about it earlier, the governor has recently started to talk about how to get people back to work when it is possible. And one of the policies that we're exploring on a statewide level would be what Chief Sylvester, what you're already doing, and that's to take the temperature of employees before they go to work or out on the field. And the idea is, and some municipalities have been talking about this and implementing their own best practices. I know Walmart now is taking the temperature of all of its employees before they can report to work. And it sounds like that's a good practice and one that will allow to keep us safe and keep do what we need to do to get rid of the COVID-19. Practically, what would you say to that? Is that a policy that could work? What are the pitfalls? Is this something that would be appropriate to have employees that are going to be in contact with people to have their temperature taken before they go on to their shift?
So it's an interesting situation. We spend a lot of time. We're talking with our school district already about what restarting the area is going to look like. We're not going to get into the argument of whose decision that is, but certainly we're all having opinions on what it's going to look like and how we're going to make that happen. We've been taking temperatures for a few weeks now, and even between different departments within a municipality, for the police department, it's complicated because people are showing up at all different times. We have 3 shift changes, but there's overlaps. Then there's administrative personnel that come in at different hours. So, there's a lot of challenges in terms of, can you afford to dedicate a staff member to just guard the entrance, all day long? And most times we can't. It's a supervisor that's running the tour who may have to go on a call. So some of what we do is self-monitoring, and we've got to trust employees that they're in fact going to be taking temperatures as we go. The equipment that we're getting is not necessarily top notch, so we're hoping for these screenings to be as accurate as possible, but they're not always. When we look at the large scale, some of the things we talked with our school district about is that, when you have several hundred students coming in at the same time, I don't know what that's going to look like when we try to socially distance people and bring them on board. I know that, my family, we traveled and we were on a cruise before this all began, and they were already taking temperatures, and they were fairly efficient at putting a few thousand people on a boat with everybody having their temperature taken as they got on. I don't know what that's going to look like when it becomes a daily operation for every single student in the school district. That's going to be interesting. So, we're glad to be sort of the test subjects on this one, and we're doing what we can to get people in. It's something that's working for right now, but we're very different than very different than necessarily some of the larger groups or agencies that are going to try and do it. I'd imagine you need more staff, you need more equipment, and you need more time in order to test all these people and get everybody into work efficiently. So, I think we're all going to lose some efficiency when some of these things come down, when it becomes regular life that everyone in every job is taking their temperature before they can enter a building for work or for whatever else. But that's going to have to be factored in, that lack of efficiency, and hopefully it's something we can get used to. But like I said, I'm curious to see how it's going to work on a larger scale for something like a high school when you've got 1,000 students showing up at the same time looking for their temperature to be taken.
Yeah, no, thank you. Makes a lot of sense. Unfortunately, I heard you on this. My phone cut out there, but it's back. I had to plug it in over here. The battery died.
I started getting worried when your video dropped out.
Yeah, right. You're like, where'd you go? But no, it's really interesting, and it's something we're trying to coordinate on a statewide basis. So hopefully we can do that. Chief Franzoso, did you have something to add about the temperature taking?
We have implemented that just as the police department has. The Department of Health has kind of given us some guidance to do so. I do think it will be something that's beneficial. Unfortunately, people who are asymptomatic sometimes are carrying this and can pass it along. So, the temperature might not just be the only thing that people need to watch out for if they have flu-like symptoms, body aches and stuff, staying home, trying to avoid those situations. If you are sick, don't go to work. If you are sick, don't go to school. You run the risk of infecting other people or getting other people sick, and who knows where they're going to bring it to or who they're going to bring it to, because they may be asymptomatic too. They might be a carrier. So, it's tough. It's definitely something that needs to be addressed. For us, it's definitely working. It kind of gives people a little bit of a sense of security, knowing that, they've checked their temperature, they're checking their if they have flu-like symptoms, they're checking their vital signs on a daily basis, just self-monitoring, just to kind of help themselves. But, it will be important moving forward. But just like Chief Sylvester said, it's going to be difficult for, organizations to combat that, schools to combat that with a lot of students, with a lot of employees coming in certain places. So.
Right. No, that makes a lot of sense. Well, gentlemen, I want to thank you for being with me tonight. I know I've taken up a lot of your time. You guys are extremely busy. We appreciate the work that you're doing. I just personally want to thank both of you, and I want to thank all the members of our police departments around New York State and our ambulance corps members, most of which are volunteer in our region. And just thank you for the work that you're doing. It's extremely important. So any way that we can be helpful, please stay in touch. Any problems that we run into, and make sure that I know, so we're advocating for you on the state level. And again, my hat goes off to you. Thank you for the work that you're doing, and always going above and beyond for the residents that you serve. So thank you so much. And I want to thank everyone for joining us tonight, and encourage you to keep joining us here. We're doing these Facebook Live events as regularly as possible. And also, I'm continuing. I do a senior advisory committee. Tomorrow, we're going to be meeting. So if you'd like to join us, we do that via conference call. So please call me, at 845-623-3627 and sign up for our Senior Advisory Committee. Also, we have our Veterans Committee and our Student Advisory Committee. We've been meeting. It's been working out. We're staying up on what's going on and getting good ideas on what we can implement in New York State. So please continue to join us. And any questions that you have, any problems, don't hesitate to contact me. My office is here to use as a resource so that we will get through this together. So please, in the meantime, stay safe, stay positive, and look forward to seeing you soon. So, gentlemen, thanks for joining me. Again, we had our Chief of Police of the Ossining Police Department, Chief Sylvester, and we have the Chief and Director of the Ossining Volunteer Ambulance Corps, and that's Chief Nick Franzoso. So thank you so much for being with us. Thank you, everyone, for watching. Look forward to seeing you soon.
Thanks.
Thanks for having us.
Thanks, guys.